Far too often, insurance companies use prior authorization and step therapy to delay and sometimes flat out deny patients from accessing the treatment they've been prescribed, the treatment that we as physicians know that they need.
And what's even more frustrating is the fact that 97.5% of all first-time prior authorization requests, they are eventually approved. In other words, insurers are delaying patients' access to care for essentially no reason. Making a patient wait to jump through administrative hoops for treatment, for medication, with the potential to save their life is simply wrong. It simply should not work this way.
For years, I have had endometriosis, a very painful condition. It took 2 trips to the emergency room for my doctor and I to connect the dots that I had developed an allergy to NSAIDs. And so the solution was simple. My doctor wrote me a new prescription for Celebrex. I got a new letter in the mail from my insurance company informing me that I would need to complete step therapy. There were about 10 other prescriptions that they wanted me to try on that step therapy letter. And every single one of those prescriptions involved an NSAID or a medication that I was allergic to. And this kind of thing needs to stop. Too many patients across the state have stories like mine, and we need this reform so that it doesn't happen anymore.
In addition to the negative impact that we have on patients' health and their outcomes, prior auth and step therapy have now placed an unnecessary administrative burden on the healthcare system as a whole. Up to 14% of U.S. healthcare spending goes to administrative costs incurred by the private or public insurers, compared to an average of 3 to 10% in other developed countries.
Senate Bill 612 puts an end to those devastating practices by empowering physicians to override step therapy protocols when appropriate, and by implementing new transparency, fairness, and clinical validity requirements to prior authorization processes, ensuring patients throughout the state receive timely coverage decisions and ultimately the care that they need.